welcome to this webinar. So I'm Graham Jackson, I'm a GP. I'm the Senior Clinical Advisor to the NHS Confederation, working particularly on the PCN network within my portfolio. Today we're looking at the PCN planning tool, so welcome colleagues from Carnell Farrer shortly. They'll walk us through this tool. They're working with the vaccine programme to provide this bit of software to make it easier, hopefully, to get your clinics up and running more effectively and more efficiently. Clearly, over the last few months, we've seen some fantastic innovations in IT, in everything we do in the NHS, consulting and connecting, and the rapid rollout of the vaccine programme has not been without its problems, but let's not deal with supply chain discussions. Let's look at actually making sure that if the vaccine's coming in the door, we can get it from these boxes into individuals. That's the role we need to do to make sure the population health crisis is averted or attenuated as fast as possible. So today we're going to do a presentation about the tool that the team have put together. I'm going to allow the presenters to introduce themselves. So I'm going to ask Simon to come on screen, and he will talk you through the tool first of all, a brief presentation. We've then got a bit of a discussion from Vincent about the operational delivery of this model, and of course there's Q&As and questions that we can take from all of you. And some of you may have seen this tool and used it, and others will be interested in using it going forward to help expedite the organisation of your clinics. So Simon, can you take control and talk us through the tool as it stands, please?
Many thanks, Graham, and many thanks for inviting us to join your webinar this afternoon. So to quickly introduce myself and the team, so I'm Dr. Simon Monk. I'm a consultant at Carnell Farrer. We're a health and care consultancy who have been commissioned by the vaccine team at NHS England to support the development of a tool which we hope will make the planning of your vaccination clinics a little bit simpler. And my own background in brief, I'm a doctor. I've worked across both acute and community settings over a number of years before moving into strategic health work and moving to Carnell Farrer. And I've been working with our technical team at Carnell Farrer to develop the tool, which I'm going to demo to yourselves now. So if we pause, I will just bring up my screen. So people should be able to see the screen in front of them now.
Not yet. Oh, that's better. Yes, we can now.
Wonderful. So we've designed a tool which there's currently a version 1 of on the Foundry system. The second version, which I'm going to demo now, will be released later this afternoon. People should have, anyone who is leading a PCN grouping or responsible for a designated site should have access to Foundry. However, we've heard quite a lot of feedback that people don't all have access to Foundry. And if you're having difficulty with that, I will be providing an email at the end of someone you can contact to chase on your Foundry access. When you do go to the Foundry site, you're able to click on the LVS or Local Vaccination Service workspace and then create a plan which takes you into where I'll be demoing to you now. The tool we've developed, we hope, allows you to do 4 things. It allows you to plan different scenarios for how many vaccinations you think you could deliver across each of your designated sites, assuming that you had the supply available to do so. So thinking about how you best make use of your site and your workforce. Secondly, it allows you to track the progress in delivery at your site in terms of against what your plan was, how many vaccine doses have you actually given? Thirdly, to be able to see for the population across the practices in your PCN grouping, what percentage of the different cohorts have been vaccinated to date, not just by yourselves at your local sites, but also by the hospital trusts and increasingly at the MaxVac centres as well. So you get that whole population picture. And lastly, we've built in a feature which I'll show you, which allows you to see what's been your maximum daily vaccinations you've done at your site, and how does that compare to your peers, both locally, regionally, and nationally, so you can get a sense of perhaps what more you could be doing, or to give yourself a pat on the back, but actually you're performing extremely well. So with that in mind, I'm going to give you a quick talk through. Feel free to pop into the chat questions, and my colleague Will Brown, our technical team, will be helping to answer them as we go to. So when you come into the site, you are able to pick your CCG, and you should be able to pick any CCGs within your local region. So for example, here we have North East Essex CCG. You can then pick the lead practice in your PCN grouping. So for example, here we have Clacton Community Practices, and it will then populate what NHS England's understanding is of which practices are associated with that PCN grouping. We've heard many times that those aren't quite right. And so what you're able to do is, if, for example, there's one of those practices shouldn't be there, but a different practice should be there, you're able to select different practices and add them into your grouping. Based on that, it then shows you, it calculates how many patients you have based on the ONS data in each of the cohorts within those practices. So that gives you your background information. You're then able to choose, are you going to be making a plan or a scenario for giving the Pfizer vaccine or the AZ vaccine? And indeed, very likely you'll be making plans to do both, but you may be thinking, based on what you're being supplied, which we recognise as challenging at the moment, that you may be making a Pfizer plan for 1 week and the AZ plan for another week, and the details of each will be somewhat different. And so if we stick here with a Pfizer plan for now, it reminds you of how many doses are needing, the minimum days between the doses, recognising at the moment the push is on 12 weeks, the refrigeration shelf life, batch size, and the current observation time. You're then able to add in what designated sites you're using as a PCN grouping. So for example, here, we've chosen the Bishop Stortford Football Club. You could, for example, choose, it might be actually the designated site you're using as a Cannon building. And then you're able to pick a number of parameters. So how long your session is, how many vaccination stations you have, time per appointment, your expected DNA rate, and your time per hour which each of your vaccinators won't be vaccinating. So the time they'll be, for example, refilling syringes, having breaks, etc. What we've tried to do is build in some flexibility, recognizing that you will have very different approaches to take to delivering your site, but this should allow you to try different scenarios, to think how many sessions you're doing per week, and then based on that, it calculates how many vaccinations your site should be able to deliver per week. So as you can see, based on what we have here, at the moment it says the Cannon building should be able to give 855 per week, and it flags that will mean that you're not going to deliver your 975 batches in 4 days. And so you may then look at this again and think, hang on, actually we're going to, our non-vaccinating time per hour per vaccinator might be 10 minutes. Again, it's still low, and you may find that actually you're going to be increasing your session length to 5 hours, so that Monday, Tuesday, Wednesday you have 5-hour sessions, and then you see that you can deliver the vaccinations. It tells you the minimum waiting room you would need for people waiting, and also how many people you'd expect to be observed at any one time based on that 15-minute observation period. So you can be checking to yourself, is your site going to be able to have enough capacity for that observation, bearing in mind infection control. It may well be that for your PCN grouping, you then have a second site as well. So it might be, for argument's sake, that your second site is Bishop Stortford Football Club. Probably more likely, let's say you're using another practice. And again here, you can choose your parameters, make sure that you're able to get through the batch per week at that site. And then based on those sites, it then calculates what's the minimum, and important to say, the minimum workforce which would be required to deliver those vaccination sites. And how we've split this from discussions is thinking, how many vaccinators you would need, who would be preparing a vaccine, getting consent and administering, how many people you would need to be, in terms of GPs, to be supervising the site in terms of any prescribing requirements and managing adverse reactions, and how many observers might you need to be both observing patients post-vaccination and also helping with flow. Obviously, you may be thinking quite differently about how you staff your site, but what we've tried to build in here is really what we would see as a minimum from looking at the guidance. I mean, it calculates how that would translate into required staff hours per week across each of these. And then based on the sites that you've built your scenario for, it's able to calculate how many vaccines would be, as a PCN grouping, you'd be able to give per week, and also what would be the expected revenue you'd be receiving for those vaccinations based on the £12.50 per vaccine. And then what it does, and the tool then pulls from the Pinnacle data, is able to show for each of your sites historically what's the most vaccines you've delivered in one day, over the last month or so. And so we can see that your site 1 were able to deliver 538 and site 2 400. And then it shows how that compares to your peers nationally, regionally, and within the STP. And so you can start to get a sense. For example, it looks like site 1 is really doing above average, where site 2 is a little bit below average, and would be thinking, what more could it be doing, perhaps in how it sets itself up, to increase that daily maximum rate, so that you're ready if supply does increase to be able to get through more vaccines in a week. It then shows a couple of tracking charts. So this first chart shows for your Pfizer plan, so what you just built, it shows how many vaccines you think you could deliver a week. So this is for 2,000 odd across the 2 sites. In green, how many vaccines have actually been delivered per week across your 2 sites. So you can see it's been matching quite closely there. And then, which is very theoretical, what would be across your 2 sites which you've chosen, if you were going to deliver your historic maximum, so your 1,000 odd every day for 7 days a week, how many could you as a PCN grouping vaccines give if supply wasn't a limitation and workforce wasn't a limitation? And then lastly, we're able to show at population level, so for the practices within your PCN grouping, how many of your patients have been vaccinated to date? So you can see here, so this is looking at the cohorts, which you can change. This is looking at the top 4 cohorts, up to 65 to 69s. In green, so on the y-axis, percentage of the cohorts who have been vaccinated. And in green, those that have been done at the local trust. And in red, those that have been done at PCN sites. And with time, you'll start to see the mass vac added on as well. So you get a sense across the 4 groupings that about 5.5% have been vaccinated to date. This is dose 1, and you can also look at dose 2. But if you just go down to look at the 80 pluses, it's a little bit slow. You can start to see that actually this group of practices to date have vaccinated about, in total, about 15% of the over 80s. And then lastly, you're able to save a plan so that you can then return back to the scenario you put in. So, and then you can revisit this plan at a later stage. I'm gonna pause there and pass back to Graham, but we're then keen to take any questions, and then we can look at specifics in a moment.
Great, thank you, Simon. That's a really good first walkthrough, and actually, having seen some of the evolution of this product, it's really good to see where it is now, because we've had 2 or 3 conversations. So Ruth and I have been very grateful to be able to contribute some feedback from PCNs on the way from Confed through into this tool, and seeing it now is really useful. Well, one quick question from me, Simon, before I hope you can hear me. If you've got 2 sites and 2 different vaccines, can you run that on the same tool, or did you need to run run the tool twice?
Thanks, Graham. So Yes, indeed, you can make a plan for the Pfizer, but then you can also make it at one site, and you could also make a plan for the AstraZeneca, and just very quickly you make the plan for one, you'd save it, and then you make the plan for the other one.
Okay, fine. Yeah, because it isn't a live tool that you have to do it in one, because and then clearly, presumably, in time you'll put a third tab on there as well whenever Moderna comes in April or May. It's going to be a few more months, isn't it? Okay, thank you, Simon. There's some questions in the chat which Will, I think we're asking you to answer. So I'll come back to those if you, and then we'll articulate those after Vincent's had a chat with us. So thank you, Simon. So Vincent, you're going to talk about the operational delivery of this, and can you come on screen and introduce yourself and say what your contribution is? Do you need the screen still shared, or can we ask Simon to take that?
No, I don't need the screen shared.
So Simon, can you stop sharing the screen so we get the full video, please?
Well, good afternoon, and thank you, Graham. So hello everyone. I'm Vincenza. I am the chief exec and partner at Modality Partnership. So we operate across 45 sites across the country, and we are in 19 PCNs. Really excited to see the tool being developed by Simon and the team. I think with the context I just provided, the application of the tool for us is potentially slightly different to all of you, depending on what lens you have. But what we are trying to do is use it for learning, cross-checking benchmarks, really helping each other and encouraging all our sites that are vaccinating to operate as safely and efficiently as possible. Tracking income helps as well, as you guys know, and so the tool will do that. The other thing we're planning to apply the calculator or the tool on is really to focus on the cohort penetration, which Simon showed earlier. I think I hope this resonates with many of you guys. There's a lot of patient cohorts that are not really coming forward. So I think if we are planning the different clinics that we know where gaps are, we can make more targeted marketing messages and efforts to bring patients on board. So I think there's a lot of potential with this calculator. I am getting my colleagues to use it at the site level. We will plan it at the PCN level, and in our case, because we have the 19 different PCNs reach, we will look to benchmark and share across so that we can encourage really one another to do the best we can. So we might even introduce some healthy competition to see who gets all their populations done first. But there's still a lot of wrinkles to iron out, and hopefully we can get to steady state and apply the tool the way I just described. So I hope that helps a little bit for colleagues who are looking at the tool for the first time.
That's great, thank you. So Vincent, if you could stay on screen, and I'll ask Simon to come on screen as well. Let's go to some questions and answers. Vincent, the first one just to you, because I think it's, you talk about from your practice delivery. There's a question about whether with AZ being coming down to being delivered at a practice setting, we'll be able to get access to this tool at a practice level rather than at a PCN level. So that clearly there's this could be used at a more micro level and a practice-based.
Quite happy to take that as well, Graham, if that helps.
Okay. Yeah. Either of you really.
So I think for the moment, our understanding has been that the AstraZeneca Oxford vaccine is being supplied at a PCN grouping, but as people are rightly saying, it's very likely or possible it will move to being supplied at a practice level. And the tool certainly will be able to adapt to that, so that when that does happen, so that people are able to make a plan at a practice rather than at a designated site level. So
we're already hearing, although that the guidance is as we know is catching up, and sometimes it catches up, and you get 3 sets of guidance in a day. Everyone's been familiar with that, particularly on New Year's Eve, interestingly. But there's already discussion about being deployed to a PCN site and then being redeployed to a practice, because the cold, as long as the cold chain's held and as long as the 6 hours is fulfilled, that can be done. So I think already we are seeing potential. We're hearing back from PCNs that want to just Because at the end of the day, if we listen to what Simon Stevens and what Secretary of State is saying, we need to get this. We need multiple channels to get this vaccine out. So
yeah, so Graham, if I may build on that, I think there's various channels or approaches and sites, but ultimately, from my viewpoint, it needs to map back to the practice population. So no matter what, as long as we know no one is being missed, that's the main thing. And remember, we're still in a democracy, right? So we may reach out to patients, and some of them are choosing not to take it. So I think from my viewpoint, and I might be biased, we may have sites, we have people going to care homes, you know, we have every channel, but I want it mapped back to my practice population to know that I haven't missed anyone that wants it. So that's my focus. So.
At the end of the day, we're delivering this to the population and the service to that. So Will, I'm going to come to you. I hope you can hear us now. Will is another member of the team who doesn't have a camera problem, has a camera problem. So Will, there's a couple of questions in there about Foundry pulling the data and also can you adjust the batch size? Could you just introduce yourself, Will, and for me?
Hi Graham, yeah, I'm Will. I lead the data science team at Carl & Farrell, and I've been working with Vincent and Simon to build the kind of tech side of this. So Foundry pulls data from the National Immunisation Management System, so it's something called NIMS, which takes a feed from Pinnacle and goes through. So imagine every time events go put into Pinnacle, that gets pulled through NHS Digital and into the NIMS databases, which then gets pulled into Foundry. So there's this long kind of infrastructure behind the scenes. And what this tool does, it pulls from that National Immunisation Management System, which was getting updated all the time. So this will be pulling in daily. And so when you say, I think someone mentioned about real time, it isn't real time, but it will be what happened yesterday. If you put into Pinnacle, should be there the next day. So at the moment, about 86% of event data is in there the day after. And we don't know quite if it's to do with people putting it in the data late or kind of slightly delays, but it should be pretty much up to date every time you look at it. I hope that answers that question.
So just to be clear, that you think Pinnacle is refreshing overnight. I mean, I know there are sites who are clearly splitting. Many sites are splitting their vaccine delivery from their admin Pinnacle entry. So actually, it's not real live time as it goes into the patient, it gets entered from Pinnacle. So because the admin's being done separately. So, but as far as you're concerned, technically, once it's in Pinnacle, it should come across IT-wise.
IT-wise, it will be there within, it should be there definitely the next day if it's put in the day before. But right. It would be, and that varies slightly as the volume changes up and down depending on how many people are using it. But it is not going to be something that you pick up and it doesn't have data from last weekend. It will be operationally, it is fast enough to be used day to day.
Okay. And what about the question about roving teams and housebound?
Yeah, so that is tracked and that is included within this. We don't split them out at the moment. One of the things we're looking to do is to make sure we identify those patient groups, and there's work going on at the moment. But at the moment, it's age-based and they're counted within the PCN delivery at the moment. But I do understand the very different delivery models, and we're working to try and split them out.
Okay, thank you. Simon, there's a question that says, will the finance planning include patients vaccinated by other PCNs or?
Thanks. So for now, the finance planning, what we show is based on the scenarios you build for how many your site or sites how many vaccinations they could deliver per week. So if you, for example, think you can do 2,000 Pfizer vaccinations per week across your 2 sites, then it calculates how much revenue would be associated with that. But at present, it's doing it on a site basis rather than how much income is coming to the individual practices. But it's certainly something which we could think about for the future.
And whilst I've got you there, I mean, I asked the question about the plans, and you said separate plans. Someone's asked the question again. Can you? So Alison, there, can you combine the 2 or 3 vaccines into one session? So I think you're saying you need to write a plan per vaccine.
That's right. And the reason we've built it like that is that our understanding from engaging with a number of PCN operational leads has been that people are thinking about the setup somewhat differently because of, for example, the Pfizer vaccine takes longer to separate into syringes, etc. And so the time per hour which isn't spent vaccinating typically is a bit longer for the Pfizer vaccine. And so people are finding that they're planning slightly differently for the two. And so it's likely, I guess, that a Pfizer clinic, people are finding that they can get through they can do less vaccinations per day than at an AZ clinic. But it may be with time that people find it's quite similar, and then actually it's as easy just to make a combined plan.
Yeah, okay, thank you. There's a, I mean, Vincent, maybe you might be somebody else, but there's an operational point of view. There's some Russell Barnes he said about, can you have different appointment lengths for different patients and different staff?
Yeah, I think for our local planning, there's certainly different variables like this to consider. But I think for the calculator where it's at the moment, you will just try to do an average. I think sometimes if you over split hairs on this, it doesn't really happen in real life. Do you know what I mean? Like the 85-year-old may have taken just slightly longer to get settled. You know, it happens on the day, guys, as you know, whoever's running this. So the plan, you know, the calculator will do a good job giving you a ballpark view, but you know, build some cushion into it. I wouldn't make it so precise overall. And I think the other thing, I'm looking at some of the questions here around Pinnacle and planning and claims and stuff. We've had issues along the way with whether it's the slowness of the system or maybe records not updated. So what we've done on the ground is where necessary reverted to paper and then tracking it and reconciling on the back end. So so nothing fancy, but just being practical, I think, is the key.
And I would just build, Graham, briefly on Vincent's point about the planning. That I think one way which I think we see it as useful is to be able to consider different scenarios. So to think, for example, if you had more vaccination stations, or if you were able to, on average, shorten your appointment, or to reduce the amount of non-vaccinating time per hour, what that could do, just so that you start to think through how can we increase throughput. But as Vincent rightly says, you know, you're going to have nuances, you know, within your locality, and so it's not going to give you a precise number, but it's going to give you that ballpark, which we hope is helpful.
And if I may add to that, remember this is a calculator, a planning tool. So you know, a vaccinator who's done 2 clinics versus 10, first timer on the day. You know, there's lots of things like that, guys. As you know, on the ground when we're delivering it, that you just need to factor in. And just again, just staying positive, to be honest, and working through it. But the calculator gives you a sense, but it cannot answer every question in planning in detail. So.
The interesting point there, Vincent, like you say, it's a planning tool. I think it's good. That's a really good timing to remind us of that, in fact, because looking at some of these questions here, there's a question, is it, what is the role of the CCGs currently to coordinate with STP geography, and will CCGs have access to the tool to monitor delivery? So this is ostensibly a planning tool for PCNs to plan their delivery, but there's already concern about whether others will have access. So will CCGs have sight of this? Simon?
At the moment, this is just for PCN users. So the information coming in is to help PCNs plan. It's not a performance management tool at all. The reason we've provided information about how other people are doing within it is more basically people wanted to know. People want to know how they're doing versus other people, and so this is a way of sharing that information across PCNs, because I think from everyone we've spoken to, everybody trusts that if the vaccine's out in the PCNs, the vaccines will get done, and it's just a case of making other people aware that this is a fantastic way of delivering this vaccine. And the more we can prove that most PCNs can deliver 975 in a day, the greater the opportunity is to send more vaccine down these channels and to really make it fly.
Yeah. So if I may jump in on this, Graham, you can see I'm a supporter of this tool because it helps with planning. Not once have I crossed my mind that this is going to be a performance management thing. I am using it more to encourage and to make sure we haven't had any risk of wastage or where we're falling behind for whatever reason. It's really just that. So I think, by the way, guys, you know, NHS England and other regulatory bodies or whatnot, there are many other ways in which they can apply performance management on this. I might be biased. Our view is, you know, what best intelligence can I put in place for the team to do the best job we can and get it done as fast as possible. So that's kind of the mindset that we have. We don't really I don't want to say we don't care, but we just want to get the job done and the best that we can. So it's not about performance management, at least the lens that I've taken.
No,
so if the CCG wants to see it, go for it, is kind of what I'm saying. So.
I completely understand where you're coming from. I'm smiling, thinking the number of people on this call will know that NHS England has a number of ways of regulating and
definitely.
I think I would just briefly build on Will's point that I think one of the benefits, or two things actually. I think firstly, it's able to show at a local level just what capacity there is to be delivering vaccinations. And so, as you know, certainly as I've been seeing, speaking to yourselves and on social media, really the concern seems to be more that there's not enough supply coming locally at the moment, rather than there's not the capacity within primary care to deliver the vaccine. And I think this helps to show that as well. And so it really, it supports primary care, I think, in that way. Secondly, by showing how you're doing at a site compared to your peers, I think probably helps to introduce a little bit of healthy competition, that people can start to see, oh, I've been able to do at my site 450 in a day, whereas, another site in my SCP might have been doing more like 600, and it starts to help me to think, oh, I wonder, could I be tweaking my delivery plan to increase it, or are there very legitimate reasons for it?
Yeah, and I think that competition comes from people actually seeking that competition, and actually, rather than being competitive, they're actually speaking peer to peer, saying, how did if you've managed to achieve this throughput and I haven't, can you advise me? Can you support me? Can you help me see how? An interesting question about ordering of vaccines. As we move from a push to a pull model on vaccinations, is there ability based on activity and future delivery for this to be part of the pull model of ordering vaccinations in the future?
I think I can take that. Yeah, there is. We're exploring that at the moment. I think it's a good idea. I think having one place where you can combine planning, allocation, previous deliveries in one place would make a lot of sense. But there's obviously there's lots of sensitivity about what's being allocated where, and we just need to make sure that it's presented in the right way and also that it's usable. I know the current system of kind of various emails flying around the place isn't going to last much longer as we scale up. So it's just finding somewhere within the LVS it will sit, and we just need to work out what's easiest. And we'll probably be reaching out to people to understand how they'd like to use it, how they'd like to order, and how they'd like to track that, because it seems at the moment it's not working. So we do need to fix that.
I certainly believe that we should all be planning for a smooth supply chain. I think that we accept at the moment the supply chain has got bubbles in it and it is spluttering. But actually, we do know, we have been told, for example, 100 million have been pre-ordered for AstraZeneca. The numbers are there. So I think we do need to start thinking about what's the tool that helps us. If the supply chain is full, how do we make sure that it is flowing to the right places? So that's good to hear that that's got a link. A couple of questions about CCGs again. I mean, comment from Alison Rogers there saying CCG is not performance managing but supporting. I take that on board, Alison, absolutely. But from Irfan, can the CCGs access the data? Forget the regulatory oversight stuff, but this is actually CCG supporting PCNs, which is what we're encouraging. Can they access the data at the CCG level?
So there are dashboards within the Foundry system which are for different user groups. So for kind of CCG users, trust users, regional users, and so they will have access to dashboards relating to their area, and that's already being set up at the moment. They're within the PCN area of Foundry. There are also those statistics about your own individual site as well that people can access now. And it's basically that there is the same view that's just permissioned differently based on where you are sitting.
Okay, good. So that's
CCGs will be able to see CCG data, trust will be able to see trust data, regions will be able to see region data, etc., etc.
Okay.
And so just to add to that in brief, that I guess what it means is that a CCG would be able to sit in the same way that this tool is showing a PCN grouping, how quickly, what percentage of their different cohorts have been vaccinated and where. At a CCG level, similarly, they'd be able to see for the CCG population the percentages have been vaccinated and where, so that they can then start to see how they can support. And similarly, when you bring that up to regional level.
Okay. There's a couple of questions I think you may have said in your presentation, Simon, about the number of lots of data in there. query about changing the batch size. So the batch size, if you're splitting your batch, you're getting your box of 975 and you're splitting it down and sharing it between 2 sites, for example, can you, in your planning tool, change the batch size that you're planning for?
I'm just looking to you. I'm pretty sure you can change the batch size.
You can change that. We've got a default kind of warning for when you're not going to reach 975 in a week, but feel free to ignore that if you know you're getting 300 or 150 or 450 or whatever kind of multiple of 75. And of course, it's different for the AZ batches, which are coming in 100 at the moment. So yeah, you can adjust that, and I think making sure that plan fits. And really what we should add as a feature is whatever you input, we should have the warning based on that. But yeah, you're right, we should do that, and we will.
Okay, there's a couple of questions about, the penetration across the country and availability. I know you said before about Foundry, but could you just, maybe Simon, just reiterate again how people can get hold of this tool, and it is available to all?
Absolutely. So to get access to the tool, you need to have access to the Foundry system, which is the NHS system, and within Foundry to have access to the LVS workspace, which is the local vaccination service workspace. Anyone in a PCN grouping, who's involved in running a PCN grouping or supporting it, is allowed to have access. People should have access already, but we've heard lots of people don't. And if they don't, then the best thing to do is to email, and I think we'll be putting the email up at the end on a slide and also sharing it out with you, the help desk at NHS England, who actually, from my experience, have been pretty responsive in coming back to, to sorting out Foundry access. And we're also pushing for that to be as quick as possible.
Okay. Again, there are some really good practical questions coming through, actually, about the one about the, again, back to batch numbers and doses, sorry. But I mean, if you've got a box of 975, but you're actually doing the 6th dose, you're actually, if you're using the 6th dose and some have squeezed a 7th, allegedly we hear, in different parts of the country, making sure they've all got their 0.3, hopefully, for their first 6. I mean, therefore, you are delivering more doses than you had planned for.
Absolutely. So you could in the same way, rather than making, so I showed you how you make a plan for how many vaccines you can deliver across your site or sites in a week. But if you've decided locally that rather than giving 975, you're going to be giving 1200 odd doses instead out of a batch, then you would be making a plan to give those 1200 doses in a week. But we will, I think it's a good feedback. We will build in a functionality that it then flashes to warn you if you're not going to reach that number.
Yeah, I would also say it is really 1170, but I think given the guidance for getting, if you're having more than 5% wastage, I think there's something in the enhanced service says that would be a problem. And so aiming for 1170 would mean you've got a lot more wiggle room here. And hopefully this tool, because what you can do is you can look at what Pinnacle and what NIMS has seen for the last week, and that may or may not tally up. And that's really important, because if that doesn't tally up, then that's the information coming through that's going to be wrong and different, and that may affect the rest of the program. So I think it's a good way of double checking what you think has happened versus what's coming through. So looking week on week and seeing if it's lower than it should be, because it might well be there's some issues that are on the tech side that need to be fixed.
And I think the chart which I demoed should be able to show you that. You should be able to see what your planned doses per week was and how it compares to what the actual has been.
Okay, just those the audience, you can look at the chat function if you've got that up. Then the team have posted the website, the email address, sorry, for Foundry into the chat going on. I mean, there's lots of really operational questions here. We've joked about people having bits of paper in their clinic because of Pinnacle keep falling over. But actually, someone's actually saying, can they print this plan? Can they actually print this plan off? Is it printable? Is it exportable, the plan, or is it only a web-based tool?
Will, do you want to say something? So I'd say that for now, what you can do is when you make a plan, you can save that plan and then revisit it. At the moment, it doesn't have a download function, but it's certainly something which we could build. But what you can quite clearly do is you can do a print screen of it and then just print that off as well.
Yeah. Okay. Thank you. I mean, and there's some questions around Pinnacle, and I know that that's not your bit of software, I guess, and I guess there's issues about people concerned about the Pinnacle not being correct or linking through. But I mean, every piece of software is going to have its bugs, I guess, and we can't ask you to design a bit of tool and fix all the bugs in its feed software. That's a bit unfair, I guess.
No, but I think that's right, Graham. But I think what this does, I hope, help to do is to provide some transparency back to yourselves, in primary care, of what is actually being reported up, nationally, so that you can start to see where that's not correct, and then you hopefully create that positive feedback loop, which will improve things as well. Because particularly now, in fact, I've got a colleague on my team who's helping with the stats, the national stats collection daily, and actually, there's obviously a lot of scrutiny of these stats, and I think, in a sense, that's a good thing in improving the quality of these data flows.
The question here from Sue Parham has actually left, but was to answer it. She's working across 3 PCNs. So can she write a plan for each PCN and pool the plans? So
I think it's a good question. I think there's 2 ways which Sue or others could do it. You could either choose to make a plan for each of your PCN grouping, which in some ways would make sense because you have your group of practices with 1 or 2 designated sites, and you want to be making a plan for how you vaccinate at those sites for that population, and you do the same for your other 2 PCN groupings. But equally, she may decide that actually she wants to view it as bringing together all the practices across those 3 PCNs, which you can manually do. As I showed, you can just add practices in to create your own PCN grouping. And then for that PCN grouping, you could pick 3 or 4 sites to do it. I think it would probably make, I would probably make most sense to do it for each PCN grouping separately, just because you might be thinking differently about it, but you could do both ways. I think Graham, you might be on mute actually.
I was. Thank you very much indeed. I was trying to cough. So Kate said, I've emailed that email address and got an auto reply saying it won't answer any Foundry related questions. That's the email.
If she wants to, so I didn't catch the lady's name, but if they want to forward that to me, and if people put my email address in the chat and it'll be on at the end, then I can certainly look into that. Certainly we've emailed it before, they have followed up, but we can double check that, of course.
Yeah, that was Kate Sylvan, your question at 1312 that you put in there. So we'll put that contact. It'll be really helpful, Simon, to have that. I mean, I appreciate this is all sometimes it's quite small stuff, but actually this is the small stuff that unplugs it, particularly
to get the Foundry access.
Okay. I mean, I think a lot of the questions coming through are now looking at the technical stuff that we've answered, really. Are there anything else that you want to comment on, Vincent or Simon or Will, at this stage?
I don't have anything more to add.
Okay, thank you.
I think probably two things to add from me, Graham, is firstly that, or maybe 3 things. Firstly, that this tool will be released later this afternoon, so really encourage people to access it, and if they're having challenges to follow up with a Foundry stuff, but to be patient, to make this, we really want to create something here which is useful for yourselves, and to have a play around with it. Secondly, if there are things which you'd like to add to it or which just aren't quite right, please do get in touch. You can see my email up is here. And thirdly, to say that we will be releasing future versions. We're aiming to do that every week or so. So I think one of our top priorities is thinking about the supply issue, which Will was discussing, like how we link in the supplier ordering and availability. So that's one of our top priorities to solve with the vaccination program colleagues. So do keep checking, each week to see, what's new on it as well. And we'll be working with Graham and Ruth to provide updates on that as well. But really, thank you for your time on behalf of myself and Will.
And so I think that's great, Simon. Thank you very much. And then just again to reiterate to those other PCNs there that please contact in through the PCN network and Confed, because Ruth and I are having weekly meetings with the team, and we have been able to contribute your feedback we've had from the field already, as I said earlier, but actually, no, when you're using it out there, we need to tell us, and we can certainly help that, and we'll carry on building this. It's a great tool. I mean, I've seen the evolution of it over the last few weeks. I think it's really, really helpful. And what's really good is the attitude we're getting from the Carnell team about making sure that this really is reflective and reactive to the needs of the PCNs. So thank you for the tool. Thank you for the presentation. This has been recorded. We can share this link later. Thank you to Simon, Vincent, and Will, and thank you all for listening to us. Thank you.